All right, I believe we are live.
Yes.
Welcome, everyone. Thank you for joining the Subcommittee on Health and Social Services. Today, we have one budget hearing with the Family Investment Administration of the Department of Human Services. As always, we are going to begin with the analyst, Tanya Zimmerman, move to the department, and then to a list of 5 witnesses we have listed today. And we'll have questions along the way as we go. Just a reminder to everyone, this is being streamed live. That means everything said and typed is open to the public and being streamed on YouTube, as well as available for public Public Information Act requests. So with that, why don't we go ahead and begin? We will start with the analyst report and with Tanya Zimmerman. Please go ahead.
Sorry about that. Thank you, Mr. Chair, members of the subcommittee. Today I'm presenting the budget for the Department of Human Services Family Investment Administration. The budget decreases by $2.2 billion or 47%. If you exclude the assistance payments program, the budget would increase by 7.1 million. I'm going to begin with a review of a few performance measures. The first measure relates to the average days to process applications for the 3 major benefit programs. In general, the department is required to process these benefits in under 30 days, though some SNAP benefits are required to be processed in 7 days or fewer. As you can see in this exhibit, for the data that's available from April through September, they remained well below the required level. I would note that the applications during this period have remained relatively low. One of the things that I want to note is that although the average days to process applications are relatively similar for TCA and Tdap, this is only kind of a portion of the story. So this exhibit presents information on the percent of applications processed within 30 days, with Tdap being the lower line with the triangles. You can see that they have a considerably lower share of applications processed within 30 days than the TCA benefit, even though they have the same number of average days to process. So for example, Tdap benefits about 65 to 67% are processed within 30 days, whereas over 75% are processed in that time for TCA. Not shown on this is the percent of applications processed in 46 days or longer. For Tdap, that's 25% or more. With TCA, it was not more than 15% during this period. There are more requirements related to the Tdap program, and so particularly related to medical certification of disability, which likely impacts the time it takes for individuals to compile the documents that need to be submitted. Moving ahead to data on job placements and retention. So the department has suspended or modified work requirements for the TCA program through much of the pandemic. They were initially suspended and then they were modified such that most cases were in good cause through the rest of the period. They were suspended again kind of in the fall as the department transitioned to the new IT system. And they also transitioned to changes in the enforcement of work requirements under Chapter 457 of 2020, which alters the sanction process. They did begin enforcing the work requirements again in January 2022. As you can see in Exhibit 4, the number of job placements has fallen dramatically over the last 2 years, given the suspended and modified work requirements and the economic conditions related to the pandemic. We would expect those to increase again as the economy continues to improve and the work requirements begin to be enforced. One notable thing about this exhibit is the job retention line, which is the blue line. From federal fiscal 2012 through 2019, this hovered between kind of 77% and 79%. But it fell dramatically in federal fiscal 2020 to 69%. This was the lowest level in the data that we have dating back to federal fiscal 1998. And that's generally due to the kind of economic conditions related to the pandemic. We would expect these to kind of continue to rise, but I would note that DHS intends to use a portion of the funding from the TANF Pandemic Emergency Assistance Fund for job retention bonuses at 4 and 6 months. Similar to TCA work requirements, the SNAP requirements for able-bodied adults without dependents have been suspended throughout the pandemic and continue to be suspended through at least June 2022. And as a result, the number of participants in the SNAP employment and training program have fallen dramatically over the last 2 years. Exhibit 6 presents some information on the outcomes from the SNAP employment and training program. In federal fiscal 2020, the number of individuals in unsubsidized employment in the second quarter after completing the programs actually increased over the prior year. And the median quarterly earnings in the second quarter after completion were at effectively the same level as federal fiscal 2019. Both fell pretty dramatically in federal fiscal 2021. This is not only due to the economic conditions, but with fewer participants in the program, that impacts the number of people in the unsubsidized employment. There are 6 deficiency appropriations included in the fiscal 2023 budget, totaling $2.9 billion for FIA, including one that changes the source of funds rather than the overall funding level. The vast majority of this increase is $2.9 billion is for the SNAP program due to higher caseloads and benefit levels that were anticipated in the budget as enacted, and to provide funding for the PEBT benefits. There's one deficiency appropriation that provides approximately $1.7 million, primarily in general funds, to support an early phase-in of the Tdap benefit increase that is required under Chapter 408 of 2018. That brings the benefit level up to 100% of the TCA benefit for a one-person household. With this deficiency that begins in January 2022 under Chapter 408, that would have occurred in fiscal 2027. The budget continues that level, continues the benefit at that same level in fiscal 2023. The remainder of the deficiency appropriations relate to federal stimulus funds. Exhibit 7 highlights the deficiency or the federal stimulus funds that relate to FIA. These are not all deficiency appropriations, though those are highlighted, the ones that include deficiency appropriations. The largest of these is in the PEBT benefits that provides funding equivalent to the amount of funding that a student, equivalent to the benefit a child would have received if they were receiving free lunch in school, but they did not because the schools were closed due to the pandemic. This is a portion of the deficiency appropriation I mentioned earlier related to SNAP. And this is for benefits that were provided for the prior school year that due to timing continued into fiscal 2022, as well as the anticipation of paying benefits in fiscal 2023, in fiscal 2022 for the current school year if their application is approved. When the second line is related to a deficiency appropriations that just replaces some TANF funding with state fiscal recovery funds. This was intended in the supplemental budget number 5 to the fiscal 2022 budget, but couldn't occur at that level in fiscal 2021 because of federal guidance. And so it's occurring in fiscal 2022. The second to last line on the screen here is uses TANF Pandemic Emergency Assistance Funds. It's about $17.8 million that are being brought in by deficiency appropriation. That's from the American Rescue Plan Act. They're using these funds to phase down the additional benefits that have been that were received in the first half of the calendar year for TCA recipients, and then also the job retention bonuses that I mentioned earlier. There's also a deficiency of appropriation of just under $1 million in the Emergency Food Assistance Program related to additional food commodities. And the last item that's related to a deficiency is $10.2 million for contractual staff for a SNAP case management, and that continues into fiscal 2023. The total Family Investment Administration budget is $2.46 billion. 89% of that is related to the Assistance Payments Program. And so this shows the spending in the budget that's outside of the Assistance Payments Program, which totals about $279 million. 55% of that is for personnel, including the caseworkers. About 35% of that is for contracts and grants of a variety of different types. 37 million of that, 97 million, is for employment and training program contracts. Exhibit 10 highlights the major changes in the fiscal 2023 budget. I'm going to draw your attention to the assistance payments kind of area to highlight some of the enhancements and other changes. There's $4.8 million to expand the Summer SNAP for Children program, under which children in certain jurisdictions receive an additional benefit in the summer months and through in December when school is not in session. This program began in fiscal 2021 and is mandated at $200,000. Under this program, local jurisdictions apply and receive kind of a state match for what they put up. The state share is based on the public school construction matching rate. So this provides additional funds so that additional children can be served through the program. And we've asked the department to comment on whether it's expected to increase the number of jurisdictions that participate, or whether it's expected to increase the participation rate in the 6 jurisdictions that participated in fiscal 2022. And we've also recommended committee narrative asking for information on the participation in the program in fiscal 2022, or fiscal 2023. The next line is $4.8 million to annualize the increase in the Tdap benefit. The last line on that page is another enhancement for the supplemental SNAP benefit for seniors program that increases the maximum state funded benefit to $20. The budget anticipates that to cost an additional $2 million compared to what's in the budget. I would note that the amount that's in the budget in fiscal 2022, most of that is not going to be used for that purpose in fiscal 2022. Because so far no benefits have been provided under the program in that year, because with emergency allotments, no households are receiving less than $30. It's uncertain when the emergency allotments will end, but because USDA is approving those on a month-to-month basis. It's also uncertain the number of recipients that will be in the program when the program continues, because the benefit hasn't been provided since March 2020. There's a $17.6 million decrease related to TCA due to anticipated caseload decline. The last 2 lines, the PEBT benefits are not expected to continue into fiscal 2023 because they are only available through the end of the national public health emergency and then the summer following that. The budget also decreases for SNAP by $1.3 billion to align with the fiscal 2021 actual expenditures. It's again very uncertain what the benefit payments will be in fiscal 2023. Fiscal 2021 was a year with high benefit levels due to the emergency allotments and historically high caseloads. It's uncertain when the emergency allotments will end, as I mentioned earlier. And with the recertifications just having begun in January 2022, it's uncertain what the caseloads will look like. However, we anticipate that the funding in fiscal 2023 is likely to exceed, likely to be several $100 million less than the appropriation, but they would just cancel the funds that are unneeded at the end of the year. Exhibit 12 presents information on the number of Tdap recipients. When this budget was presented to you last session, the number of recipients was at historically low levels due to issues related to recertifications and verification of documents. However, the department in February 2020 began to re-enroll, or 2021 began to re-enroll certain customers that had had their cases closed due to recertification and verification issues. And then the Relief Act that was passed last year required the re-enrollment of customers unless the closure was due to certain reasons, and then prohibited case closures through the end of June unless the closure was related to a final determination on an SSI or SSDI application. So as a result, the number of recipients returned to kind of near pre-pandemic level, and then has stayed at that level even after the prohibition on case closures ended under the Relief Act. Through November, the cases decreased fairly substantially in December. That was due to some unerrant case closures, and the department is reopening the cases that were closed in error. In fiscal 2013 or fiscal 2023, the budget assumes the caseload remains at a similar level as it did in fiscal 2022, but the average benefit increases just due to the annualization of the benefit increase that I mentioned earlier, resulting in the higher spending in that year. The number of TCA recipients had held relatively steady from May to September and then began to increase. The last month of this chart shows that decrease in December, which is again related to some closures that occurred in error. January data that is not on this chart shows that the number of recipients continued to increase in January. A couple of factors appear to be resulting in this increase. The pandemic unemployment insurance programs ended in September. Unemployment insurance counts as income towards the program, so additional households may have become eligible. In addition, the department notes that other federal stimulus benefits ended, which may have contributed to additional households seeking assistance. Both the department and DLS forecast the caseload to decline with the beginning of recertification and as the economy continues to improve as a result of the economic improvements from the pandemic. Both DLS and the budget assume the average benefit remains at relatively the same level, which I'll discuss in a moment, and that results in a decrease in the overall funding. The TCA Cliff Initiative, which provides funding to recipients, provides benefits to recipients for 3 months at the same level as they were receiving in TCA when their cases closed due to earnings too high or employment, had remained at kind of relatively stable levels. The number of recipients through May 2021, since the program had begun. However, beginning in June 2021, the number of recipients dramatically increased and has stayed at these much higher levels than had historically occurred. And that's resulted in spending significantly higher than the amounts in the budget to date during the year. The high level of recipients are occurring at a time when the case closures are relatively low in the program, so it's unclear what's driving the high number of recipients based on the stated eligibility criteria. And we've asked the department to comment on why the program appears to be serving more people than should be eligible under that criteria. And we've recommended adopting committee narrative, requesting a report on the causes for the increase in the participation in the program. This exhibit presents information on the personnel. The budget abolishes accounts for an abolition of 15.5 long-term vacant positions. The vacancy rate is very high within the administration. The department has some plans to help address this issue. You heard about this issue during the DHS administration analysis, so I'm not going to cover it here. I would note that, as I mentioned earlier, there's a deficiency appropriation of $10 million, and that funding continues into fiscal 2023 from a state administrative grant for SNAP under the American Rescue Plan Act that DHS indicates is being used to hire contractual staff to assist in processing redeterminations for SNAP. And they anticipate that those funds can support 188 contractual full-time equivalents. And we've asked the department to comment on their efforts to add the contractual staff given the current high vacancy rates, and if those contractual staff will have a pathway to transition to regular employment. Issue 1 discusses SNAP benefit levels. Exhibit 17 presents information on the maximum monthly allotment for SNAP households dating back to federal fiscal 2008. Outside of the kind of Great Recession, which resulted in a temporary boost in the benefit levels in SNAP had remained relatively stable. In fact, were slightly lower in federal fiscal 2020 than they were at the end of that boost that was provided as a result of the Great Recession. In federal fiscal 2021, the benefits increased by about 5% due to high inflation in the month that they were calculated. And then subsequently, the Consolidated Appropriations Act provided for a temporary increase of 15% in the benefit, initially through June, when that was later extended to September. And then for federal fiscal 2022, USDA announced an increase of about 23% in the maximum monthly allotments due to a reevaluation of the Thrifty Food Plan upon which the benefits are based. This reevaluation was required in the 2018 Farm Bill. However, this impacts the TCA and Tdap benefit levels going forward. So under state law, the TCA benefit plus the SNAP benefit are required to equal the 61% of the Maryland minimum living level. That's 61.25% beginning in federal fiscal 2023. In times when the calculation would otherwise result in the TCA benefit decreasing, the department in practice holds the benefit at that same level. So that happened during the Great Recession with that temporary increase in SNAP, so that the benefit was held steady for several years. It also happened in federal fiscal 2021 due to the higher than normal SNAP benefit increase. Based on the benefit increase in federal fiscal 2022 and assuming kind of regular inflationary increases in both the Maryland minimum living level and the SNAP benefits going forward, DLS does not anticipate that the TCA benefit would need to increase until federal fiscal 2028 under this calculation. And as a result, the Tdap benefit would also not need to increase until that time, since it's also tied to the TCA benefit. The second issue relates to application denial rates and case closures and the reasons for application denial and case closures. I'm going to skip ahead to the discussion of the case closures. Exhibit 21 provides information on SNAP closures and the reasons for those closures since October 2020. As you can see, during most of this period, the number of case closures was relatively low. And kind of for the beginning portion of that period, kind of verification and cooperation reasons were the primary cause of case closure. Verification kind of declined as a reason as the time has gone on, with income being too high, largely taking its place as the largest reason for case closures. In May 2021, there was a kind of a spike in the case closures that occurred related to the waiver that the department was operating under at the time for the recertifications. And as some customers weren't eligible weren't expected to be eligible for the continuation of that extension. The number of cases closing due to failure, reapply, or recertify dramatically increased in that month. They later received an additional waiver, which was retroactive, and those cases were reopened. But it does provide a note of caution about as the department kind of begins the recertification process, which began in January 2022, that customers may experience some difficulties, that customers that remain eligible may experience some difficulties. Some of the households may choose not to apply because they no longer believe they're eligible. But there could be some difficulties for those who remain eligible. And we've asked the department to comment on the efforts they undertook prior to beginning the recertification to refamiliarize customers with the processes and steps it's taken to limit case closures for those that remain eligible due to failure to submit the recertification. Exhibit 22 shows similar information for TCA cases. Again, the number of case closures remains low and has continued to decline through the period. In this case, income too high is the predominant reason for case closures during most of this period, with verification and non-cooperation being the second highest reason. Tdap carries a number of additional requirements that the other programs don't have related to medical certification of disability and time limits based on the type of case, as well as applying for SSI for certain cases. And so the reasons for case closure are more varied, and they have varied over time. So the red bars are for kind of the early period when there was kind of a temporary end to the recertifications extensions, and most of those closures were due to failure to reapply. And then after that period, kind of prior to the Relief Act, there was a change in the reason for case closures, the predominant reason being the short-term time limit. So those are the bars in the green. After the Relief Act was passed, which limited the reasons for case closures, the reasons for case closures were kind of more widely distributed among the reasons that were kind of allowed under the Relief Act. Ultimately, the highest share of closures were related to not totally disabled, which is a category that generally includes the medical certification having expired or not been provided. And most of that happened in June 2021 as they were kind of preparing for the end of that prohibition on case closures. From July to November, which are the blue bars, the department generally has limited case closures to reasons that would have been allowed under the Relief Act because of the continuing recertification extensions. The category no eligible members has historically been related to places where the final determination on SSI had occurred. However, the department indicates that there was a data issue and that resulted in some of those closures, and they reached out to the impacted cases, and those cases were reopened that were impacted. There are 4 recommendations in the analysis. The first is related to information on application processing times, denials, and case closures. The second is one that I already mentioned related to information on the children served in the summer SNAP program. The third recommendation requests that the department provide information on the PEBT spending that's separate from the SNAP program. And the fourth recommendation is the one I noted earlier, requesting information on the reason for the increased utilization in the TCA CLIF program, a copy of a program evaluation that they're undertaking, and information on the job retention bonuses that they're providing through the TANF Pandemic Emergency Assistance Fund. I would note one update that I'm not going to cover. It's related to the PEBT program and the current status of the application to continue that program for the current school year. And that concludes my presentation, and I'm happy to take any questions.
Thank you. Before we go to questions, I'm going to apologize and step away. I have another meeting I have to briefly attend. So the vice chair will take over at this point, and then I will be back as soon as I can. Thank you all very much. I'll be back soon. Geraldine, you got it.
I got it. Okay, here we go. All right, let's behave while he's gone, everybody. Any questions for the analysts from the committee members? June, help me. I don't see any hands up. Is that correct? Okay.
Hands.
No hands?
No.
Okay. Okay, then we'll hear from the department. From the department, it looks like we have Secretary Padilla, Ms. Sonic Cabret, Mr. Stafford, Ms. Alea, and Mr. Munasami. Did I get that right? Mr. Waite?
Yes.
That your full panel, Secretary?
Yes.
Okay. If you want to go ahead and start, and then we'll reserve our questions for when you're finished.
Thank you, Co-Chair Valentino Smith, and member of the committee, for the opportunity to discuss the FY 2023 budget allowance for the DHS Family Investment Administration. And thanks for introducing the team. I should also say that available to answer any questions is Daniel Wade, Director of Human Resource Development and Training, and as you stated, others as needed. I want to take the time to thank Tanya Zimmerman for her always thorough and thoughtful analysis. The department greatly appreciates Tanya's continuing involvement with the Family Investment Program, even though her portfolio has increased. We know that. She's a pleasure to work with, and we appreciate her support. I also want to thank the staff and local directors of our 24 local Department of Social Services for the dedication and hard work through the past year, and especially during the COVID-19 pandemic. Without them, there is no DHS. You have my written testimony, which I won't repeat here. Before I address the recommended actions and issues in the analysis, I would like to take a moment to highlight some of our activities and accomplishments for the committee. Maryland families continue to face significant challenges during the second year of the COVID-19 pandemic, and DHS has been there to help. Our mission has never been more important. The Family Investment Administration now manages over 770,000 cases across all family investment programs. FIA safety net programs are serving 300,000 more individual recipients compared to pre-pandemic caseload levels. This is a 35% increase in cases served. During fiscal year 2022, DHS continued to distribute SNAP emergency allotment benefits, resulting in over $1 billion in additional benefits provided to active SNAP recipients. The senior SNAP program would increase the minimum benefits from 30 to 40 starting July 1st, 2022. This supplement is funded entirely by general funds. The FY 2023 budget allowance for the summer SNAP program increases to $4.8 million, allowing the program to expand statewide. Tdap benefits have been increased and are now aligned to the equivalent TCA benefits. Recipients saw monthly benefits increase from $243 to $256 on July 1st, 2021. And recipients received another increase to $328 on January 1st, 2022. The new eligibility and enrollment system, part of MD-THING, completed its statewide deployment last November. 100% of Maryland SNAP, cash, and non-MAGI medical assistant cases are now managed by an innovative, secure, cloud-based web service built from the ground to serve Marylanders. That concludes my opening remarks. Now, with your permission, I will move directly to the recommended actions and issues in the analysis.
Thank you. Yes, thank you.
The DLS analysis contained 4 recommended actions. The department concurs with the 4 recommendations. Turning to the 5 issues for discussion. In response to issue 1, regarding efforts to improve employment retention for participants in the SNAP Employment and Training or ENT programs, DHS has made and continues to make efforts to improve employment retention for participants in SNAP ENT programs. Currently, we educate new and existing SNAP customers on employment and training opportunities and provide a comprehensive overview of the various training programs that are available. We screen each SNAP applicant using a recently enhanced tool and promptly register them for work opportunities. In addition, when a customer starts a new program, there is another complete assessment of their abilities. The enhanced initial screening and program assessments help in matching the customer to the most appropriate program, which enhances their chances of successful completion and employment. We also work with customers to arrange various support, childcare, transportation, and educational advancement opportunities offered by our third-party partners. DHS continue to explore additional ways to improve employment retention and other outcomes for these programs. In response to issue 2, regarding how the increased funding for the summer SNAP program will be utilized, thanks to the increased funding, DHS look forward to serving additional recipients. DHS is encouraging all jurisdictions statewide to apply for the summer SNAP program for FY 2023. As I previously noted, DHS concur with the analyst's recommendation to adopt a committee narrative requesting information on the number of children served throughout the program. In response to issue 3, DHS concurs with the analyst's recommendation requesting a report on the causes of the increased recipients in the program and a copy of the evaluation. Customers are returning to work due to a more favorable job market compared to the peak of the pandemic. The department anticipates the caseload will stabilize to pre-pandemic levels over time. In response to issue 4, regarding DHS efforts to add contractual staff and the potential for contractual staff to transition to regular positions, DHS is aggressively recruiting to fill both contractual and regular positions in FIA. As of February 16, 2022, we have hired 88 new contractual staff. Of equal importance, of course, we have also hired staff for 254 regular positions. We expect this increased rate of hiring to continue as we move forward. Finally, interested and talented contractual employees do have a path of conversion to regular positions. In response to issue 5, regarding the efforts DHS has made and continues to make to help customers with the recertification process and limit case closures for eligible customers due to the customer's failure to submit their recertification material, DHS regularly educates customers about the program requirements as part of the initial application process. DHS sends our customers materials, including application and notices, to advise them of the responsibility to respond to agency requests and correspondence, and particularly to recertification notices. We understand, though, that as we transition out of the extraordinary measures taken in response to the COVID-19 pandemic, including suspension of the normal redetermination process, some clients may require additional support. In response, we have made additional efforts to alert customers of the change, such as sending emails to nearly 650,000 customers, notifying them that recertifications are resuming, leveraging our social media platforms, including Twitter and Facebook, to reach the target population, and sharing of recertification policy changes with our local departments of social services staff, our statewide call center, and our SNAP outreach and SNAP ENT partners so they can share with our clients and the community. We're also took the additional step of calling those customers with a February recertification due date to remind and encourage them to submit their recertification material. Looking forward, we're also looking to add auto dialing and texting technology to the FIA outreach toolbox. Our Office of Constituent Services is also fully staffed and trained to assist clients in need. This concludes my testimony and response, and I will be happy to address any questions the committee may have. Thank you.
Okay, committee, looking for questions. I see first Delegate Henson.
Thank you, Madam Chair, and thank you, Madam Secretary, for your detailed responses and the presentation. I have a question about the move for contractual employees. I heard you state that you have hired 88 contractual employees to date and intend to hire more to be able to supplement the workforce there. I know that this committee has taken great interest in the performance of the Baltimore child support contract and it being unique in being contractual as opposed to state employees. And the results that we've seen there have not been the type of results that we want. We want to see our agency able to run smoothly, see people able to get the services that they are expecting from our state agency. And our experience there with the Baltimore contractor has not given us a great deal of confidence that that's the particular route to go. It sounds like what you're doing is having the contractual employees hired and supervised and working among the state merit employees, if I'm understanding that part correct. And then if so, I wanted to understand why we thought that this would produce the type of results we're looking for.
Thank you, Delegate Henson. Very good question. I want to reiterate that the Baltimore City child support contract is very different from the contractual employees that we are hiring for the Family Investment Administration. Many of the contractual employees that we're hiring are former retirees, people that were family investment and specialists in the past that have retired, and that we are bringing them back through the opportunity and the 188 positions, as noted, for the emergency that we have, given the volume of work and the vacancies that as you heard, we have. And it is just a temporary measure to be able to continue delivering the services timely, while at the same time, we are continuing the aggressive hiring process that we have talked about. So we're doing both. We're hiring the contractual, we're hiring the permanent employees, and if during the process we can also transition the contractual employee to a permanent position, I'm going to allow our Director of Human Resources to elaborate even more on the efforts that we're taking and why this was decided to we decided to take that approach. Mr. Danway, if you would please.
Thank you so much, Delegate Henson, for giving us an opportunity to talk about the efforts that we're making to fill positions of the department as quickly as we possibly can. As the Secretary noted, there is a significant difference between the Baltimore City child support contract and the contractual staff that we are bringing on. The contractual staff that we are bringing on have the same exact performance measures as our existing family investment staff. So, and they are managed directly by our existing family investment staff. It is not an outside contractor that's doing the work. They are in fact state employees, but they are state employees in a contract rather than in a regular merit pin. The department believes the best way that we can support our existing staff is to fill as many positions as we possibly can, as quickly as we can. So we are taking an all or a no wrong door approach to this, which includes the creation of the contractual positions and filling them as quickly as we can, while at the same time filling the merit vacancies that we also have within the department. And then looking at opportunities for those contractual staff who have talent, who show that they are good at this work, to contractually convert over to merit positions. This gives us flexibility to move quickly, to be agile, and to be efficient in filling our positions.
Thank you for the response. I appreciate it. If Madam Chair will permit me just one additional question.
No, please, this is an important area. Continue on.
Thank you. I wanted to get some clarity on the unintentional case closures. I saw that in December 21, the number of Tdap recipients decreased by 27.5% compared to the year prior, or compared to the month prior, pardon me, and that was due to some unintentional case closures. Can you help me understand that better?
Absolutely. Thank you for that opportunity for us to provide further clarification. I'm going to have the Secretary Director for Family Investment Administration address your question.
Thank you, Secretary, and thank you, Delegate Henson, for your question. In December 2021, we had a policy discrepancy that occurred related to disability information for those customers. Since we had identified that, we swiftly went to reopening those cases, and at this time, we can report that all of the cases that were impacted by that discrepancy were reopened.
Thank you. What type of notice and outreach did you give to the beneficiaries about what had happened and when they could expect to be restored?
Thank you for your question. So we have reopened the cases in such a fashion that the customers did not lose any receipt of benefits. So in the timeline in which we did the reopening, again, there was no lapse in benefits coverage. Upon the reopening of the cases, the customers did receive notification regarding the cases being reopened.
Thank you. The information that we have states that all the cases were reopened by were slated to be reopened by February 18th, and that the unintentional closures happened in December. So I wasn't sure if there was a January benefit and one anticipated in February that was a lag between discovering the error and then repairing the error. But I do appreciate the response. Thank you, Madam Chair.
Thank you. So I guess the conclusion was that everybody that was dropped off that Delegate Henson was asking about has been picked back up.
That is correct.
Okay. Thank you. Delegate Henson, is that all?
Yes, thank you, Madam Chair.
Okay. Members of the committee, does anybody else have any questions for the department? Okay, before we move on, I think you've talked a lot in issue number 5 and in what Delegate Henson was talking to a little bit about the concern that we have that now that recertification has started, that it's a difficult population to reach and how onerous some of the recertification requirements are, on top of you having a decreased staffing level and sending a lot of information out to the locals. So reading your response, it looks like that during the month of February, you took a lot of steps. Is it reasonable that by the end of March, you would be able to tell us how successful you were in terms of the numbers that are recertified, or so that we can see something before we leave session, Madam Secretary?
I believe we will be able to collect some initial data. We wouldn't have the full analysis because, unless you are helping out here, the recertification would not have been completed by the end of session, but you can explain that a little bit better if you would.
Right, and before she goes on, so just what I'm reading, it says during the month of February, DHS took further steps to call customers with a February recertification due date. So when will we know if those with a February recertification due date, how many and how many were successful?
Yes, thank you, Secretary, and thank you, Madam Vice Chair. So within a 60-day time window, we would be able to provide some preliminary analysis regarding those individuals who have completed their recertification. So we have a first set of 30 days in which the customers are required to submit their recertification paperwork and complete their interviews. If the customers complete their interview and they have some outstanding verifications, they do have a second set of 30 days to return those items so that we can complete the recertification.
And are you requiring in-person meetings in the first 30 days for certification? Or are you doing some remote?
We are doing hybrid. The majority of our interviews are telephonic. For any customers in which we do not have a telephone number for them, we are conducting outreach to do our best to obtain the best contact number for them. And if the customer does not have a number by which we can conduct the phone interview, or if the customer would prefer to have an interview at our offices, we have staff that are conducting in-person interviews.
Thank you. All right, I think that concludes the questions for the committee. So with that, we'll go to the witnesses. Sorry, I have to open it up real quick. I think the first one's Lisa Klingenmeyer from Welfare Advocates. Lisa?
Thank you, Madam Vice Chair and members of the committee. My name is Lisa Klingenmeyer. I'm here today representing Welfare Advocates, which is a coalition of service providers, community organizations that are working to create adequate safety net programs and advance families into economic security. We're here today in strong support of the department and the programs that fall under the Family Investment Administration. We do want to start off by saying thank you. Thank you to this subcommittee and to the General Assembly and to the administration for your work on these programs, especially amidst this global pandemic. Several of the programs that you all put in really did provide tangible benefits to our families who are on our public benefits programs, and we thank you for those. And we also thank the administration for some of the recent budgetary additions, including moving Tdap up to a family of one on TCA early, and also having the additional dollars in the senior SNAP program. At the same time, we know that low-income families are still struggling to find some sort of economic stability after the pandemic. The majority of our caseload is still well above the levels they were before the pandemic. So even though we might start seeing some signs, maybe more globally, that things are starting to stabilize, we know for low-income families in Maryland that just hasn't happened yet. And while they're still struggling to find economic stability, some of the programs we have put in place are started to be pulling away. The federal government, depending on if they renew the state of emergency, the maximum SNAP allotments might end in the coming months. We already know for our families on temporary cash assistance, that $100 they were receiving extra each month is now being slowly stepped down. So by the time we hit May, they will be back to their pre-pandemic levels of temporary cash assistance, but not necessarily back to any kind of economic stability. So as we have this opportunity of a historic state surplus, we really do hope that low-income families, especially low-income families that are in our safety net programs, are a part of that conversation of how we might leverage some of that money to create economic stability for these families. I especially want to highlight, and DLS did a great job of this in their analysis, that because of the increase in SNAP on a federal level, which is very important and needed, but because of how we calculate temporary cash assistance in Maryland, that now means for potentially the next 6 years, TCA families will not receive any kind of benefit increase to their temporary cash assistance. They will be flatlined at $727 a month for a family of 3. And that's amidst historic inflation and costs rising. We will essentially have a flat funded safety net program. And we would really encourage conversations about how can we use this historic moment to re-envision how we calculate safety net programs, what it means to truly provide a benefit that's livable to low-income families, because we know it takes the longest for those with the lowest incomes to recover. And this pandemic's been quite the economic crisis. So how can we be using these dollars to really support low-income families and individuals? So we thank you for the time and for all of this great work and appreciate your support.
Thank you. Are there any questions for Ms. Klingenmeyer? Okay, thank you. Next, we have Mr. McLean. Is he here from Movable Feast?
Hi, can you hear me?
Yes, we can.
Great, wonderful, thank you. Yes, I'm Sam Zisso-McLean. I'm the program director at Movable Feast. And as some of you know, Movable Feast is a nonprofit provider in the community of home delivered, medically tailored meals and medical nutrition therapy. And we are serving people that are living with both chronic illness and food insecurity. We exist to improve the health of Marylanders by getting people the right food at the right time. And we're very grateful for the support of the department in pursuing this goal. As you are undoubtedly aware, and as has been mentioned, the COVID pandemic has placed a lot of additional demands on community-based service organizations. And we're very proud that the support from the Family Investment Administration helped us provide over 200,000 meals to Marylanders in need during 2020 and 2021. We're happy to be here today to support the proposed budget, and we look forward to our continued partnership with the state and continuing our mission to feed people, fight disease, and foster hope. And that's it. Just wanted to thank you for your time, and I'm happy to answer any questions.
Thank you, Mr. McLean. Are there any questions for Mr. McLean? Okay, seeing none. Next, we have Ms. Gilmore from AFSCME, and it looks like you have a panel with you, Ms. Tyndall, Mr. Whitehurst, or Ms. Whitehurst.
I do. Thank you so much, Delegate. Good afternoon. My name is Denise Gilmore. I'm a field director with AFSCME Council 3. We represent the state employees who work in the Family Investment Administration. We are very concerned about the high number of vacancies that continue to persist in FIA and across DHS, and particularly on the impact they may have on services. Our members will certainly talk more about that here in a minute. We disagree with the solutions that the administration have put out so far to try and address these vacancies. The first being to downgrade the qualifications for the position of family investment specialist. They want to remove some of the experience and education requirements on that. We don't think that that is a smart thing to do in the long term as we continue to try and improve customer service in the agency. We also are concerned about the use of contractual employees, for many of the reasons that were listed before. Certainly with the surplus that's been mentioned, these seem like we are cutting corners unnecessarily. These jobs started under $35,000 a year. We certainly think the agency would have more success if they just, raised the salaries above that. So I'm going to hand it over, I think, next to our members, but we very much appreciate the opportunity to testify. Thank you.
Thank you. Mr. Tyndall, you want to go first?
Good afternoon, delegates. My name is April Tyndall, and I'm AFSCME local member of 112. I'm also a family investment specialist, and I work in long-term care in St. Mary's County DSS. Since early in the pandemic, we've been under a hiring freeze, and that's left many positions open for long periods of time, and it's left us short-staffed in family investment. After 2 years, we're finally kind of coming out of the hiring freeze, and so now is not the time to be cutting more pins while we're already short-staffed because of the freeze. The answer that management has proposed to help with staffing is to bring in more contractual employees. While we're tasked with gathering and holding a lot of sensitive information and confidential information about our customers and our communities, we should be prioritizing hiring and retention of career employees. learning and understanding the complicated regulations and how to interpret the regulations in order to have real case management takes a year or more. So temporary contract employees aren't going to have a chance to learn what it really takes to be a case manager or really what they're being tasked with. When you bring in more contractual employees, you're also creating a revolving door. Most of these contractual employees are going to take these jobs in the hopes and promises that they're able to get a merit position. But more times than not, that's not the case. And those employees, eventually move on to jobs that offer benefits and competitive salaries. With such a large surplus, it's hard to understand why we're making such awful staffing decisions. And ultimately, it's going to be our customers who suffer in the revolving door with staff that aren't experienced enough to assist them or to find the benefits that they might be eligible for. Thank you for the opportunity and your attention to these important and urgent matters.
Thank you, Ms. Tyndall. We'll hear from Ms. Whitehurst, and then we'll see if there are any questions for this AFSCME panel. Ms. Whitehurst.
Good afternoon, everyone. It has been stated over and over again, my name is Velvet Whitehurst. I work for Wycomico County Departments of Social Services. I'm a member of AFSCME Local 112. It's been stated over and over about the large amount of vacancies and the return of the redeterminations, which we are getting in droves. It is very overwhelming for staff to complete all these recertifications because we are getting them. They're supposed to be coming over the electronic way, but most people in our agency have been bringing them in. We are proud of our low error rate during all this pandemic. We are very proud of that. But we don't think the solution for the jobs, as far as our jobs, is downgrading the qualifications. We don't think that's a good solution. We would rather them raise the wages so that we could retain good employees. I also wanted to kind of touch base on a health and safety issue. We had a gun violence situation in one of our agencies in the metropolitan area where a gunshot went through a window. So we would like to, from an irate customer, we deal with them from day in and day out, and some of our offices are located in not the best neighborhoods in the world. So we would like for the administration to do a health and safety fix that covers every office, not something from jurisdiction to jurisdiction, something that is statewide. Thank you for your time.
Thank you, Ms. Whitehurst. Before I ask a question, does anybody from the committee have any questions? Okay. I'd like to ask AFSCME and Ms. Tyndall and Ms. Whitehurst to work with Ms. Gilmore to let us know in the next couple of weeks what's going on with the recertifications and how you're managing them from a caseload perspective, and how it's working not only for you as the caseworkers, but for those that are applying for recertification with either electronic system or having to work through paperwork. And then I'd like to ask the department, now that we've heard from Ms. Tyndall and Ms. Whitehurst, I have a concern that the 60 days, given the shortage of caseworkers and the increasing demand and the potential shortcomings of contractual employees, do you have it within your discretion to increase the 30 days and then the additional 30 days for recertification, or is that a federal requirement?
First, thank you for the opportunity to expand on the information provided. But before I do so, I want to share what one of the witnesses said when they said they were proud of their low error rate. And as I stated, I thank the local DSSs and for all their work through the pandemic. And I also have to say that I'm also proud of our timelessness numbers. So I'm saying that because even though we had an influx of applications during 2020, 2021, and 2022, the department has been processing the work timely and accurately. So that's a lot to be said when we know that the rest of the world was struggling to meet the customers need. In Maryland, in Department of Human Services, in Family Investment Administration, that wasn't the case. We were delivering benefits. Our focus was on the clients and the people that we serve. The goal was to make sure that benefits got to them timely and accurately. And I can say that we seem to have accomplished both. In terms of the time period for us to processing the work, I want to have Ms. Ayala expand on that.
And thank you. And before she does, it sounds like you just gave a very strong statement for asking the governor to increase the salaries for those that have been on the front line and achieving such good results with higher caseloads.
Yeah.
Thank you, Secretary, and thank you, Madam Vice Chair. In relation to any extensions or modifications to the 60-day timeline associated with completion of recertifications, that is an item that is at the federal level that would require a request to modify.
Okay, well, thank you. I would hope that you'll make the request if you find it necessary. It's good to hear you have the confidence in your local caseworkers during this important recertification process, and hope that you can work to find the funding for them. If there are no other questions, unless staff tells me otherwise, I think that concludes the hearing for today, and we're going to reconvene with budget hearings on Wednesday. Is that correct? Getting a nod. Okay, we'll see everybody Wednesday. Thank you, Madam Secretary, and your staff, and thank you for the witnesses that stayed to help us understand this very important population.